quorum. Is that correct, Laura?
Yeah, let's see.
The Finance
Yes.
Committee.
Finance.
We have Mr. Dillinger. We have Karen Seal and Bernie McCabe.
Okay. So we have 3, so we can have the finance meeting. That's fine. And then we need 6 regular members to have the board meeting.
Okay, we have those 3 plus Chief Milliken plus Susan. And I did see Brian
Judge
on.
Moore.
Judge Moore.
And Judge Moore.
Okay.
Oh, excellent. Okay, I'm just not seeing
We
everybody.
have 7 at this moment.
Oh, okay.
Am I correct, Laura, that you count 7 also?
1, 2, 3, 4, 5, 6.
I don't see Brian now.
Yeah, Brian's not on any longer.
Right. I do not
Okay.
see him.
So as long as we have 6, we're okay for the board meeting.
Yes, we have Susan Ralston, Bob Dillinger, Karen Seal, Patrice Moore, and Bernie McCabe, and Chief Logan.
So we really appreciate every single one of you being here, as we
Yeah.
always do, but
We
thank you
appreciate you more today.
even more. Thank you, Judge Moore.
And I believe we are ready to start.
Okay.
We are live on YouTube and recording, so. Good morning, my name is Laura Peel. I'm the JWB Director of Information Technology, and I am your technology moderator. Board members, I want to take a roll call to verify that audio communication is working. Please say present to indicate when you can hear me. Now mute your devices until your name is called. Susan Ralston.
Present.
And I'm just checking for Brian Ongst. Again, he's not on. Bob Dillinger.
Present.
Bernie McCabe.
Present.
Chief Milligan.
Present.
Judge Moore.
Present.
Karen Seal.
Present.
Thank you. Now I'm going to turn it over to our CEO, Beth Houghton. We can't hear you, Beth.
There we go. And Colleen, as a matter of practice, do I need to read through both of these things for both meetings?
Yes.
Okay.
Please do. Yeah.
All right.
Best
Good afternoon. I'm Beth Houghton, CEO at JWB, and this is a Finance Committee meeting of the Juvenile Welfare Board of Pinellas County, and it's being conducted remotely consistent with Florida Governor DeSantis's Executive Order 20-69 of March 20th, 2020, due to the current state of emergency throughout the state of Florida, given the outbreak of the novel coronavirus, COVID-19. In order to mitigate the transmission of the virus and reduce risk of COVID-19 illness, we have been advised and directed by the state to suspend public gatherings, and as such, the governor's order EO 20-69 suspends the requirements of the Sunshine Law to have all meetings in a specific public place and to require a quorum to be present in person. EO 20-69 has been extended by EO 20-150. These executive orders posted on JWB's public notices website allow public bodies to utilize communication media technology to conduct its business. For this meeting, JWB is convening via Zoom webinar and telephone conference posted on our website, which clarifies how the public may join and participate. A public meeting notice was published in the Tampa Bay Times on July 1st, 2020, as required by Section 189.015 of the Florida statutes. Please note that this meeting is being recorded on Zoom webinar and YouTube Live. Also, some attendees are participating by telephone conference. Participants are advised that people may be listening who do not provide comment, and those persons are not required to identify themselves. Accordingly, please be aware that others may be able to see you. Anything that you broadcast may be captured by the recording and will become a part of the public records of the Juvenile Welfare Board of Pinellas County. Laura Peel, JWB's Director of Information Technology, will serve as the technology moderator of the remote participation by JWB members, JWB staff, presenters, and the public. I would remind you to mute yourself if you're not speaking. Laura.
Yes. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Board members, when I call your name, please respond in the affirmative. Susan Ralston,
Yes.
Brian Ongst,
Here.
Bob Dillinger,
Unmute, Bob.
Bob Dillinger. I don't hear you. Let me
You may
ask.
want to come back to him. It looks like he stepped away
Present.
from his desk.
Hear it.
Present.
Bernie McCabe,
Here.
Chief Milliken,
Here.
Judge Moore,
Here.
Karen Seal.
Here.
Staff, when I call your name, please respond in the affirmative. Beth Houghton,
Here.
Judith Warren,
Here.
Laura Brock,
Here.
Linda Leedy.
Here.
Anticipated speakers on the agenda, please respond in the affirmative. Colleen Flynn,
Here.
Diana Carroll,
Here.
Lynn Delator,
Here.
Laurie Lewis,
Here.
and I also had Mary Grace Duffy, but I do not see her on here. And there is one caller as a panelist, 6198. Could you please?
Yeah, it's Mike Grego. I was asked to call in. Mike Grego.
Okay, great, thank you.
Glad you're here.
Please
Thank
mute
you.
your device until you're called on to speak.
All of the materials for this meeting are posted on JWB's website with the agenda for the meeting, and we recommend that JWB board members and the public follow the agenda as posted unless we note otherwise. Now turning to the agenda, before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to assure that we have accurate meeting minutes. The chair will introduce each item on the agenda. After staff has presented the item, the chair will entertain questions by board members. Please physically raise your hand in the Zoom webinar to be recognized. If you're on a telephone conference, please press *9 so the moderator may unmute your line. We have public comment before the vote on each action item and during the open agenda. So please use the raise hand feature in Zoom webinar or press *9 if you're on a telephone conference line to be recognized to speak. The moderator will call on each person by name or the last 4 digits of the call-in number, allowing 3 minutes per comment. And finally, each vote will be taken as a roll call vote. Further, for all participants, board members, staff, and public, please remember to mute your phone or device when you're not speaking. And remember to speak clearly and in a way that helps generate accurate minutes. With that, I'll first turn this meeting over to Mr. McCabe, Finance Committee Chair, to handle the Finance Committee, and then to Mrs. Ralston, JWB Board Chair, to commence with our regular JWB Board meeting.
Thank you. I don't have the agenda in front of me, but I think the only thing on our agenda is approval of the minutes of our Finance Committee meeting. And so I'll entertain a motion to approve those minutes.
I move to approve the minutes.
It's been moved and seconded that we approve the minutes of the Finance Committee meeting. Do I need a roll call vote?
No.
Okay, Laura, would you do that, please?
Do we need one, or did you say no?
No, you said, somebody said yes.
Okay,
Just of the finance committee members though, Laura.
okay. Board members, when I call your name, please state your vote. Bernie McCabe,
Yes.
Bob Dillinger,
Yes.
Karen Seal.
Yes.
Thank you.
All right, having no further business, we'll call the meeting adjourned. Turn over to Ms. Ralston.
Well, then we'll proceed with the calling of adjournment from our Juvenile Welfare Board meeting of Thursday, July 9th. And we'll begin with a calling for a motion to approve the consent agenda items as presented.
So move.
Thank you. Second?
I'll second. Dillinger.
Thank you. Laura, do we go for the, a call for a vote, please?
Laura, board members, when I say your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
Dr. Grego.
Yes.
Thank you.
That motion carries. We'll go on to action items, which is item 3 on the agenda, beginning with action item 3A, ratify Finance Committee recommendations from their June 25th meeting. And Laura Brock, I'll turn this over to you for a presentation.
You, Chair Ralston. So we are here today to ask for approval to award the Boys and Girls Club of Suncoast with the amount of $52,677 for startup fiscal year 20 and the annualized amount of $310,547 for the middle school Azalea Middle School Academy program. We have walked through the different evaluations with the proposals and the interviews as well. And the reevaluation of the committee came up with an 83 average weighted score for the Boys and Girls Club of Suncoast. So we recommend that this be ratified. I'll turn it back over to Chair Ralston.
Well, before we go to questions or comments, let's at least get a motion on the floor.
I'll move the recommendation.
Thank you, Mr. McCabe. And Karen Seal, thank you for that second. How about some questions, comments? Hearing none, I'll ask for Laura to tell us if there's any request for public comment.
You're muted, Laura.
I can see
Thank
she,
you. I was giving it a moment, but it doesn't look like there's any comments from the public.
well, then let's proceed with a roll call vote, please.
Yes, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
and Dr. Grego.
Yes.
Thank you.
Action item 3B, ratification of CEO approvals of contracts for emergency funding and emergency purchases. And that's between the period of time from June 3rd to June 26th, 2020. Laura, back to you.
Thank you. Yes, we have one item today to approve, to ratify. Nothing in the emergency funding category, but in the emergency purchases. The one item is a $75,000 award approved for the purchase of food and distribution to the children and the families in Pinellas County through the Feeding America Tampa Bay. And so we're here to get ratification for that approval of that contract.
Very good. Let's put a motion on the table and then we'll see if there's any questions. Can I have a
So
motion,
moved.
please? Thank you, Chris.
I'll second.
Thank you. Any questions, comments, concerns? Hearing none. Laura, is there a request for public comment?
No, there's no request for public comment.
All right, please proceed with the roll call vote.
Yes, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe. Bernie McCabe,
yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
and Dr. Grego.
yes,
Thank you.
Action item 3C, approve extension of emergency response compensation period through the September 20th board meeting. Laura?
Yes, as you are aware, with the pandemic and the emergency response policy, we would like to allow our CEO to extend that emergency response period. On May 14th, the board approved the extension through 60 days, which expires July 13th, 2020, and we are recommending an additional extension through September 15th, 2020, which will coincide with our next board meeting. Chair Ralston?
Let's put a motion on the floor, please. Do I have a motion to approve?
Motion to
I'll
approve.
move. Second.
Any questions, comments, or concerns about this item? Hearing none. Laura, do we have a request for public comment?
At this time, we do not have any public comments.
Please go ahead and do a roll call vote.
Yes, when I call your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
Dr. Grego.
yes,
Thank you.
Thank you. That motion carries. Let's go to action item 3D, which is the adoption of the fiscal year 21 JWB regular board meeting schedule. And I would draw your attention to the inclusion in our board packet of the dates for the meeting, and like to think all of you have reviewed those dates. There is one change in June. The board meeting will be held on the third Thursday of the month instead of the second. So I please, for those of you that have standing commitments on, say, first Thursday, second, third, fourth, just make sure that notation is made on your calendar. And as typical, we will not have a board meeting in August. Otherwise, they're pretty, as expected, scheduled the second Thursday of the month at 9 a.m. So I think at this point, we'll call for a motion. Anybody want to make that motion to approve these meetings?
I'll move it.
Thank you. Second.
I'll second.
Thank you. Any other comments or concerns about the meetings for next year? Hearing none. Laura, do we have any requests for public comment on this item?
No, we do not. There's no request for public comment.
Thank you. Please call for the vote.
Yes, board members, when I state your name, please state your vote. When I call your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes,
Chief Milliken,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
and Dr. Grego.
yes,
Thank you.
This motion carries. Our final action item 3E, which is to approve the fiscal year 21 preliminary budget and adoption of the proposed millage rate. Laura, Brock?
Thank you. You have before you in your agenda packet several schedules and information regarding the proposed preliminary budget for fiscal year 21. The property appraiser has provided certified taxable values to the JWB staff on June 29th, 2020, and that reflected a 7.27% increase, resulting in approximately 3.9 million increase in our ad valorem revenues. The preliminary budget for fiscal year 21 is showing a $70,472,035 for children and family programs in a variety of expenditure areas. We've spent a lot of time reviewing the allocations and the programs, and in your schedule packet, there is several information. I'm going to pull up one item for us to review. Let's see here, which you have in your packet. So this is a summary of the proposal on the revenues side. And just to remind you that although the property taxes have increased, we are budgeting a 95% collection rate, if you would, on the property taxes. Our carried forward number from our beginning fund balance is 31 million this year. So our total revenues will be $110,000. On the expenditure side, under the children and family program service area, there's a $70,472,000, as well as our general government items and our ending fund balance information. So of course we have a balanced budget for the upcoming fiscal year. The millage rate, again, just pointing out that the 95% collection, we are proposing, and we'll need a vote at the end of the meeting, that we would keep the millage rate at the same, which has been that rate for probably 7-8 years now, the 0.8981. Interest income, we're proposing a budget of a reduction in that line item, and you can see the other areas as well. I wanted to point out on the budget workbook this year that we'll be putting together, the format has changed a little bit. On this particular format, we've added a column here for comments, and we've dropped the prior third year. So we've got the amended budget, that would be the most current budget for fiscal 20, as well as 21, and you can see the percentages. But what hopefully will be helpful is you can see some of the changes or some of the explanations. And the way that this is broken down in between our 4 focus areas. So the first one being school readiness. And you can see your subtotal here for the school readiness. It represents 18.2% of the total program budget. And to put that in perspective, with a year ago, that percentage was 17.9%. So it's pretty much in line with what it's been in the previous year. Second focus area is school success. And you can see the different allocations between the programs. And that subtotal, if you would, is about a 32.32% of the total program budget, which again is very much in line with the prior year, which was 32.7%. The next area being the prevention of child abuse and neglect. That category is our largest category, which is 37.27%. A year ago, that amount was almost identical, 37.4%. And then the last section is what we refer to as strengthening community. And you can see all the different programs there, which would include the neighborhood family centers and the different support services. And the strengthening community represents 12.2% of our total budget, which a year ago, that amount was 12%. So all of these are pretty much in line with what they've been in the past. We are budgeting future programming, and the contingency will be $1 million again this year, although currently we're at 407 because we've drawn down some of those funds and used those for different food and nutrition programs and so forth. In the budget workbook, following this, starting on page 10, this is the same information. What it does is it just breaks it down by alphabetical. So if you're interested in seeing how much a particular agency is receiving in our funding, because the previous schedule broke it down by program, and some agencies provide a variety of programs. So you can easily see here the different agencies, and we do fund, as you can see, a variety of agencies as well as programs. Our total again being the $70,472,000 in funds. On the administrative side, we've got some increases here due to just our COLA. So we have factored in a 3% COLA. I didn't want to go through all of these. Our statutory fees our budgeted amount for that and technology. And I wanted to spend a little bit of time on our forecast because I know that that's something that we take a look at from a 5-year out perspective. From the schedule that you've seen in the past, the fiscal 20 numbers have changed slightly just due to any amendments that we've had. So the only change that you really would be noticing on this particular schedule is what the ending unassigned fund balance amount is now in fiscal 20. And that number carries forward up into the next fiscal year. So there's been no change on this schedule relative to the property values, the percentage that we talked about, and the expenditures on the program side. We have tweaked some of those, but for the most part, we're still remaining at 110,847. What this projection shows is that we would have additional increases in our property tax values based on what we've seen in the past, but also maintaining a millage rate at the same fixed amount at 0.8981. And having seen that and going back to a 97% collection rate, you can see that we've got additional funds that we would be able to spend through either capital RFA or through the future programming and keeping the contingency. What this particular chart is just trying to show us is that when we get out to fiscal year 24, our unreserved fund balance or unassigned fund balance is at a 36%, which is a healthy percentage relative to the projections that we're seeing in this forecast. When we look at the next forecast, however, this one is projecting a recession. So we went back to 2008, which was the last recession that we had, and the property values did decline over that time period, and we used those same amounts, and the millage rates also did adjust accordingly. Using those numbers and projecting forward, you can see that we've got not as much from the revenue side, and if we maintain our programs at the same amount and not spending more money either in the program COLAs or the RFA or so forth, dropping the contingency number back down to 500,000, that would put us in a very significantly low percentage in our unassigned fund balance. We, of course, maintain a 2-month cash flow reserve, so that's factored in as well. But this is just demonstrating, if you would, kind of like the worst case scenario if we had to move forward in the recession. Of course, we don't know what the crystal ball is going forward, but of course we want to look at it from a different couple angles so we could properly plan accordingly. So I think that we are here today, unless we've got questions. I'll be glad to address those questions. We need to provide the property appraiser with our millage, a tentative budget and proposed millage rate by August 4th of 2020. And so the staff is recommending to adopt a proposed millage rate of 0.8981, which yields $78,223,000 in ad valorem revenues, and the budget amount of $110,847. I will pull this off the board and see if we have questions or comments. Be glad to hear those.
Let me make a couple comments. The Finance Committee recommends approval of this. There are a couple things to point out. The comments that Laura mentioned on the right side of the budget document, we found particularly helpful to understand the differences in things. The millage rate needs to stay the same. There was no appetite in the committee to change that. There's also a difference in the proposal out to the funded agencies for fixed asset, the $1 million we usually put in there. It's $1,250,000 this year, and that was explained that they might need additional funds based on the COVID-19 response. So the Finance Committee recommends this budget and the millage rate.
Any other initial comments before we put a motion on the table? My only comment before we poll for the motion is that we've had some discussion about our board getting back into the strategic planning process later this month. And the budget has been presented with some future programming dollars, I think of $1 million, to give us a little bit of wiggle room to respond to anything that comes out of the strategic planning workshop. So I just, again, thank you for including that. So at this moment, let's go ahead and get a motion on the floor to accept the budget and the millage rate, proposed budget, because there's still opportunity to make adjustments, but the proposed budget and the millage rate. Do we have a motion?
So move.
Thank you. And a second?
I'll second.
Thank you, Patrice Moore. And now at this point, barring no other comments, concerns, or questions, Laura, let's go ahead and see if anyone is out there wanting a public comment on this.
I'm giving it just a moment. But it appears we have no public comment.
Okay, well then let's proceed with the roll call vote.
Okay, board members, when I call your name, please state your vote. Susan Ralston,
Yes.
Brian Ongst,
Yes.
Bob Dillinger,
Yes.
Bernie McCabe,
Yes.
Keith Milligan,
Yes.
Judge Moore,
Yes.
Karen Seal,
Yes.
Dr. Grego.
Yes.
Thank you.
Well, this motion carries. That's important work that we've done today. All of our action items have been approved. And again, I want to thank the staff for all the work they've done under a virtual setting. So we'll move on in our agenda to item number 4, which is discussion. And Judith, I would not be surprised to hear today's update on the COVID tests cases in our JWB programs. Particularly, let's talk about our childcare. So I'll turn it over to Judith.
Sure. Thank you, Madam Chair, and good morning to the board members. Today, I'm going to give an overview of the impact that COVID-19 has had on JWB funded agencies. I first want to emphasize that the funded agencies have taken all necessary precautions recommended by the CDC and the Pinellas County Licensing Board. So these include wearing masks, constant cleaning, temperature taking at curbside drop-off, and keeping the children together all day in cohorts to avoid cross-contamination amongst the programs. When a program learns that a staff member or participant has been exposed or tested positive, the first line of contact has always been epidemiology with the Department of Health, who have been assigned to work with the programs to determine the next critical steps. So Linda, if you can open up the chart. I want to emphasize that this chart was published with data through June 30th. And since then, we have had 13 more positive cases. But I will say the trends by way of percentage of impact to the books of business or the books of programs have remained constant. So in total, currently, instead of 34, we now have 47 positive cases of COVID-19. And to break that down, that's 26 staff and 21 participants. And when someone is tested positive or exposed, we have one of 3 outcomes. And that is that the staff or participant is quarantined for 14 days, a single classroom is closed, or in a worse scenario, the whole program is required to shut down. All right, so the greatest amount of positive cases geographically, we're seeing in South St. Pete, and sort of the area of programs that we're seeing it at the greatest is our community out of school time programs. And for the edification of the group, that's Boys and Girls Club, City of St. Pete, City of Clearwater, Cops and Kids, PAL, Arts for Life, and we're also including our reading program and our work program with BOLI in there as well. So now instead of 22, we have 30 positive cases within that group. The hardest hit, if you will, organization has been the city of St. Pete, also known as Tasco, and they've had 15 positive cases. So the second cohort that has been impacted is going to be our early learning centers. And the Discovery Learning Center, which is operated by Park, it has impacted by 6 total positive cases. So now we're actually up to 7 within that cohort. And within our school-based programs, and that's going to be our traditional summer bridge, but now what it is just sort of an all-day summer camp-like experience. We've had 5 schools that have been impacted, 3 of which have been located in South St. Pete. We've had 2 NFCs that have been impacted, Sanderlin and Citizen Alliance for Progress. Sanderlin had to shut down only for 3 days, while Citizens Alliance for Progress was hit a little bit harder and they had a 20-day closure. We've seen a few cases within our shelters, CASA and RCS, including both Grace House and the Haven. Were able to quarantine in the hotels, and they did stop admissions for a time period. So the greatest amount of exposure has been in June, and that's not a coincidence because that is when we saw our school age programming open back up. So moving forward, some of the challenges that we're seeing is we are seeing low attendance within our summer bridge, which we were worried that we wouldn't have enough capacity. We are approximately running about 50% capacity, and a low trend consistently in attendance throughout the programming. Testing, I think that's no surprise to anyone. It takes a few days often to get tested, a wait time to get the results. And if that's a staff member that you need, that's critical to operations, then you're often having to make changes within your programming. And also what I'm going to call limited expert resources. So the Department of Health has 2 individuals that are assigned to review the cases at the Department of Health and Epidemiology, and it may take anywhere from 24 to 48 hours to receive a response. I feel like it's really critical to emphasize, though, that working relationship has been really good. They have been very thorough in their response and really rushing as fast as they can to meet the needs of these centers and programs. And so looking forward, we have had to strengthen our protocols. For instance, it didn't occur to us that we would need to ask a participant or a staff member if they had a test pending for COVID-19. But what we realized in a few incidents is that we would learn several days after an employee had showed up for work that they had a test pending and they had tested positive. So that resulted many times in shutting down classrooms and in some worse incidents, cross-contamination. At this juncture, and I know Dr. Grego is on the line, we're waiting for the schools to announce their plans for reopening. We know that we want to be agile in meeting the needs of the parents who have to return to work. We know that we're going to need to compensate for the potential learning loss that the children have experienced. And we're also going to have to provide services to mitigate potential exposure to trauma, and all of this with a lens on safety. So that is an overview, and I'll entertain any questions.
We all knew that the uptick would come.
Yep.
It's going to be interesting to see what happens between
Right.
now and then. Is Dr. Grego, I know, had to leave. Are you still on the phone, Dr. Grego?
I don't believe
He's
he
not.
is.
No.
He's not.
We do
Hold on.
anticipate next week that we'll get guidance from the school system on what their next steps will be.
Okay. Any other questions, concerns? I think obviously we're all concerned. Certainly not going in the right direction here at all.
Well, and I'd point out that we had, of course, increase in community spread at the same time that our summer programs were opening up. So you had both of those things impacting. And we're dismayed by every single case, but we're not surprised.
Right, right. Okay, a whole different topic ahead. Item number 5 on the agenda is returning to our discussion regarding a strategic plan. And Dr. Mary Grace Duffy was to, I think she's may have touched on this early on, but we're going to hear a little bit about the strategic planning environmental recap of the work that was done earlier this year and late last year. So good morning, Mary Grace.
Good morning. Good
now.
morning to the board members. I'm sorry I was having technical difficulties when you had a roll call, but I am here. So let me get this up for you and we can get started. Okay. So as we're just getting this organized, let me say that you heard these findings in March. So in some ways, this is a refresher, but I think more importantly, it's an opportunity to reflect on what is still relevant from what we heard and what is at this point, may need to be changed. Because I think with any environmental scan for a strategic plan, it's always a snapshot in time. In this case, it was about a 2.5 month snapshot from about Thanksgiving through the middle of January, end of January. So obviously a lot has changed since then. When we did these interviews, we did not have a public health crisis with the pandemic. We didn't have the heightened social consciousness and awareness of issues around diversity and equity and inclusion. And certainly the economic landscape is considerably different than it was 6 months ago. So it felt like this was really a good time to think about the relevance of what you heard in March. One of the things that we talked about, Barbara Morrison Rodriguez and I, was this notion of all of the things that influence a child's development and well-being. And I think that despite all of the changes in our environment, this is absolutely still true. That one, the child is the center of all of this as we think about the planning and the work of JWB. And what has become, I think, even more evident in the last few months is the fact that all of these elements are so interdependent and that there's really a need for an integrated approach. This is certainly not new to JWB as we look at some of the initiatives like literacy, grade level reading, hunger, preventable child deaths. We see that there really is integration and that the collective impact model that you've been using is one that really supports that. When we did the interviews and the focus groups, we were asking people to think about, ending the sentence, when JWB plans for the future, it should ... And this is really what emerged, these criteria or principles. One, that there's a hope that JWB would adopt a systems approach. So again, that notion of integration and understanding the interdependencies, would be able to demonstrate results, particularly over the long term. So really take a long-term view. Perhaps to select fewer issues, but to really laser focus on those issues, to enhance your convening role and really enlarging that, particularly by including the business community, emphasizing prevention and risk reduction, and then being really engaged in education around advocating for policy change. And again, people were clear about the difference between advocacy and lobbying, which you obviously can't do. In terms of the needs that were identified, I think these are still relevant, despite all of the changes. And they really will go through each of these individually, but really focusing on children 0 to 3, on education, on basic needs and poverty, physical and behavioral health services for children and families, child abuse and neglect. And then the one that is really different from any of the focus groups, the focus areas you have right now, is around nonprofit capacity building. So as we look at the first one, the early years, the children 0 to 3, and let me just say that on some of these slides, you're going to see some data that's in green. And these were data points that were presented at the Children's Summit. And they're really used as an opportunity just to point out why these are important, or things that you've already begun to have discussions about and had presentations about prior to March. So people were really suggesting that we consider very strongly parental engagement before birth, working with at-risk families in an early intervention model, really spent a lot of time on the importance of the first 3 years with community education. Part of that is because 90% of brain development happens prior to kindergarten. I think when Dr. McHale made his presentation, he was really quite convincing about the need and the importance of those early years. And then the last thing would be to work with childcare providers, both those that are providing in homes and also in centers, to implement best practices. This is an interesting one because what we know is that during the shutdown, while many of the centers were closed or had very limited opportunities for children of first responders, et cetera, the childcare providers in the home, many of them were stayed open. And so we may see fewer of them going out of business or having fewer services than we might on the center side. I think that's a question to be looked at, but in any event, it's important to really think about both places. In terms of education, this was one in which certainly the pandemic and having to move to virtual education for the last portion of the school year had a real impact. Judith just said in her presentation, concern both about learning loss or impact on learning that might have happened as a result of that. We know that both students who were high performers and those who might have already been having difficulty were both impacted. It wasn't just one group. And so we really need to think about partnering to increase VPK enrollment. I know that's something Dr. Grego has been quite interested in. Right now, only about half, or I should say prior to the pandemic, only about half of the students who are 3 or 4 years old are enrolled in pre-K. Really holding those providers to best practice, connecting education-related efforts that JWB is participating in more directly with the school. There was certainly a real concern about literacy and grade level achievement, and supporting alternatives to suspension and expulsion with that. So those continue to be relevant. In terms of the poverty and basic needs, this is an area in which I think there has been a lot of shifting in the last 4 months or so. We know that prior to the pandemic, Feeding America reported that about 20% of Pinellas families are food insecure. The St. Petersburg Free Clinic, who both directly distributes food and supports about 65 other agencies in the county, have reported that the demand for food has gone up 70% since the pandemic. So this is an area in which there's certainly an increased need. We know that prior to the pandemic, about 38% of families in the county were what were considered ALICE families, asset limited, income constrained, and employed. I've got to imagine that that number has gone up. And I also have got to imagine that some of the families that may have been income constrained but were employed are now unemployed. And again, that may continue until we see employment kind of coming back to where it was or closer to where it was. You all have already approved about $500,000, maybe even more, for food insecurity help with that. So again, this is an area in which the need, I don't think, has changed at all, but probably, or certainly has not diminished, it has increased. Likewise, in the physical and behavioral health services and side of things, we know that the COVID pandemic has really exacerbated stress. And as a result of that, has led to both mental and physical health consequences. So we do know that the need for a holistic approach to both physical and mental health is nothing new. We have statistics that, again, talk about both Pinellas teens, about generally the mental health situation for US children. And through the initiative, the mental health initiative that JWB has undertaken, that Pinellas County is not exempt from this. It's also interesting to note when we look back at education that a child is most likely to be expelled from a preschool setting than they are from a K through 12 setting. Now, part of that is because many of the preschool settings are private and therefore do not have to maintain enrollment of students the way the public school does. But the other thing that we know is that those behavioral issues and those mental health issues begin to show up in very young children. So again, it links into that first area of 0 to 3 and really helping children get off to a good developmental start. In terms of child abuse and neglect, we know that, again, pre-pandemic, that about 60% of the children who are in care are under 5, and more than half of those are under 3. Pre-pandemic, we know that Pinellas County had the second highest number of children in foster care. I have not seen a more recent statistic about that, but I have asked Judith about it. And, while the county may have dropped to 3, I know that over the last 10 years or so, Hillsborough and Pinellas have really, kept flip-flopping between 1, 2, and 3 in the state. So the number is still quite high. And there certainly is a need to support at-risk families to prevent removal and support reunification. We have certainly seen anecdotally and perhaps statistically that the amount of domestic violence and possibly child abuse has increased during the period of the pandemic. And then the last piece that I want to just talk about that our stakeholders talked about was investing in nonprofit capacity building. They were interested in being able to increase staff salaries as a way to prevent turnover, increase retention. They were also interested in having higher administrative and overhead rates and having JWB serve as a clearinghouse for skills training for direct service providers. I think that we know as a result of the pandemic that some of the nonprofits are going to be more vulnerable, particularly those that are really dependent on volunteers for staffing, because so many of their volunteers are in the over 60 category, which is a higher risk category. And also because many of them are very dependent on fundraising events in order to raise additional dollars for their services. And, any fundraising event that was scheduled in the spring was canceled. Some of the nonprofits have rescheduled them for the fall and are now beginning, because of all that's going on right now with cases, thinking about whether or not they should cancel them again. So I think that we're going to, see more vulnerability in that area. And I think we may also see more conversations about mergers. So taking all of that, why this isn't coming up. Here we go. There are some real implications, I think, for you as a board that, as you look at this, if you're going to laser focus, that is certainly going to require the potential of either reducing or eliminating some contracts or services. If you decide to focus primarily on the most needy families, then that may have the impact of decreasing the number of children or families who are serviced and also increasing per capita cost. We know that moving the needle on community indicators requires both partner and multi-year approaches, and really investing in longitudinal studies to measure impact over a longer period of time. And that a systems approach also involves more emphasis on policy development and advocacy. So I would say that, as you go into the workshop at the end of this month, you're going to have an opportunity to discuss priorities for JWB and the criteria that you're going to employ. I know that at various meetings, you've heard ways in which JWB can stay the course, as it were, and also ways in which it can take a different or additional approach. So there's going to be trade-offs and implications to whatever approach you take. And frankly, I think that's the really hard work. That's the hard work that the board has to set those parameters and principles that are going to inform financial and programmatic decisions. One of my favorite books is a book called Leadership Without Easy Answers. And I think for you as leaders of JWB, there aren't easy answers to this. So that's what we've heard. I would ask at this point if you have any questions or comments for me or for any of the senior staff who also was very involved in this process.
It's Bob Dillinger.
Hi, Bob.
There's a pilot program that involves the 6th and the 13th with childcare, the child welfare system.
Mm-hmm.
Do we have any idea what, if any, impact that's going to have on what we do?
Judith, do you know more about that? I know that the last time I talked to Chris, that was still in the planning stage, so it hadn't been implemented yet, but that was probably in December, so I don't want to speak.
Right. We have been working closely with Dr. Card and Brian Bostic of Eckerd. A couple of things. There is a pilot where Healthy Families is taking child welfare cases. I did speak with the program director last week, and the referrals have been low so far, but that is typical until the PIs really learn about the program and the support that they can provide. We have looked at providing on a short-term basis some FSI dollars to CPI families that are in need. These are not families that have penetrated the child welfare system, but utilizing those dollars to keep the children stable and safe within their home, to prevent child abuse and neglect. We're also looking at leveraging the kinship program to better support the population. So we've got some initiatives in place that we hope that will help and support. I know that Dr. Card has worked closely in Hillsborough with the county to develop a pretty robust pilot that would, I believe, leverage federal dollars as well. And we'll closely pay attention to that. And if there are opportunities for synergy, we'll definitely take advantage.
Other questions, comments, concerns, Susan?
Yes. Back to the piece of information on early childhood. If I read that correctly, 50% of 3 to 5 year olds in Pinellas County are not registered and not attending any you called it pre-K, but for 3 years, 3-year-olds.
It's, yes. Yeah, the 3 and 4-year-olds. So by 4, they could get into VPK, but they're
But
not,
before that, it's childcare.
it's childcare, yeah, or early learning centers, exactly.
Okay.
And that, I know that has been a major concern of Dr. Grego because it has a huge impact on readiness for kindergarten, as you can, know and imagine.
It's been a nagging concern of mine as well. And so what I would ask between now and July 29th, either staff or Beth, I'll send this out to you. It would be really important if we could get any best practices around the nation, a best in class for what communities did to move the needle on that. I think that 50% number was shocking. I'd like to know where the number came from and how current it is. But I think the situation, if it was dire at 50%, it's going to get worse during the pandemic and after. So if we could get any best in class examples when we're at retreat, that would be really important for me. And I'm speaking on behalf of Dr. Grego as well.
Yes, we will do that.
Right.
And one thing I would say that has, I guess I will say has changed even since we did some of this work from say November through February and presented in January, February, March,
Right.
is that Dr. Grego has really taken on a community-wide leadership role relative to VPK. And, I think it makes sense for one guy to be holding the baton on every issue. And it makes great sense for him to be doing that. And he has clearly undertaken that. And that's all the more reason, I think, for us to be that standard bearer, as it were, for the 0 to 3.
Right.
Doesn't mean we're going to ignore the pre-K at all, be an active participant in whatever way makes sense, but in many ways follow Dr. Grego's lead.
And I believe too, 0 to 3 still includes the opportunity for quality childcare. And that is an area that we're in that feeds into, that older toddler, that we can be there. And I do know the other players in this community are early learning and the licensing board. But I think even the 0 to 3, absolutely. But keep moving to that nudge to see what we can do to be in the arena with that.
Absolutely. And whatever ways we can be supportive,
Right.
but that don't cross over and step on each other's
Correct.
feet.
Correct. And be at the table. Bernie, I see your hand.
Yes, thank you. One thing I noticed, and I appreciate that presentation, is the failure of parents to put their kids in the program.
Right.
So it seems to me, and I don't have any idea, but somebody said, let's look for best practices around the country. Let's look for a best practice that prevents the pregnancy in the first place to parents that are totally ill-equipped to parent. I've joked before about you need a license to drive a car, you need a license to catch a fish, but you can have all the kids you want, whether you're capable of parenting or not. And the parents have to play a key role. I don't think society will ever successfully be able to parent children in the place of real parents. And I have no idea if there's an answer, but maybe there is out there somewhere. We assume, I think, with all these programming that there's going to be failure, and there is going to be failure, but it doesn't need to be 50%. My gosh. If they won't put their kids in the program, the kids are not going to get the benefit of the program. So
Well,
I
I
think
may
we have-
not be,
go ahead.
I was going to say, I may not be going as far upriver as you would want, but I would say a lot of the focus we're talking about in the 0 to 3 is recognizing that parents are the first teachers.
Right.
And empowering them as early as possible, you know, literally while the kid's in utero, but getting to moms while they're pregnant and beginning the discussion with them about what their role will be and how they can affect their child's development, whether that's in their own physical health while they're pregnant, but also in dealing with a newborn and eye contact and all of, you know, responding and mirroring and all of those things that we teach them as best we can to be the best parents they can be from the earliest possible point.
And I think that's a good idea, except I also, and I have no data to support this, would suggest that we're reaching a very small percentage of them with that training. You know, they've got to be willing to participate, or it doesn't do any good.
And that's one of our challenges, but I will say internally, that's been some of what we've talked about is how do we reach not just those people who are already looking for those resources, because they're more likely already to be doing a pretty good job.
Sure.
But how do we get the community-wide understanding of aunts and grandmothers and everybody else involved in a family enmeshed in that idea that that's the way you do it, and that's the way you raise babies, much less kids who are older. Linda?
One of the things that we are doing with our Children's Mental Health Initiative is when families come in to the pediatrician, the community health center's offices with children who are 3 or 4, their staff are having conversations, and the pediatricians are asking about whether the kid's enrolled in either preschool or VPK and the importance. So, you know, so it's a kind of a captive audience because the parents are already there and beginning to have those conversations.
Right. And taking Beth's dial back, the same thing can be happening for 0 to 3. But I think what we're saying is it's going to be the hardest to reach those that may not be having those regular pediatrician appointments. And the health department's going to be really important for a partner for us to get to that 0 to 3 and move that.
Commissioner Seal has had her hand up for a little bit. Would you like to
Thank
speak?
you.
I was unmuting by myself, but I had a thank you. Well, I agree with what everybody said, but in kind of looking over this, it just appears to me, if we are going to laser focus, we talked about 0 to 3, but in reality, it should be 0 to 5. And, you know, that would cover the VBK, childcare, food, mental health, child abuse and neglect, the foster care, trying to keep them in their homes. So I understand where Bernie's coming from. I don't think we can solve it, but, you know, thinking back in history and some of the programs that we've done, you know, the visiting nurses program for prenatal care, you know, maybe with this COVID, we're going to have to expand towards more personal help in the home in some manner. And I don't know how that's going to translate with, you know, trying to keep people socially distanced apart. But it just seems like if we are going to laser focus, maybe we need to focus on 0 to 5. And so the other thing that I wanted to mention was Mary Grace mentioned mergers, my long hopeful thing that would happen. It didn't happen during the Great Recession to speak of. You know, we've offered before from JWB merger monies and help. That might be something that we at least look at once again to see if that could be helpful. But anyway, let's see what we can do in that regard. Thank you.
Any other
Yeah,
hands?
and if I could just respond I'm sorry.
Go ahead, Mary Grace.
No, I was just going to say, if I could just respond to that. I think one of the hard things is that the nonprofits often wait until they're really, really in financial difficulty to think about merging. And at that point, they're not very attractive as a partner. And so if there were a way for JWB or somebody, maybe it's the Community Foundation or, United Way or something, I don't know who it would be, to really help people start thinking before they get to the point where they're just then doing it out of desperation, because that tends not to be very successful. Might be, something, but again, whether you would want it, that's something new to take on as opposed to slimming something down with that. So.
Mr. Dillinger, I saw your hand up.
Yes, if 20% of the children that we're talking about have mental health issues, seems to me we ought to weigh in at least on the issue of what's going on at PIMS, since they really are not allowed to take children anymore. Most of the main facilities in big hospitals and all children's will not refer children to PIMS. I saw they were going to go before the Commission for Transportation to divert children from PIMS to Morton Plant Dunedin. And I think we ought to at least have a report, because obviously that's the only places our children can get serious mental health treatment if they're meeting Baker Act criteria. And with the new Baker Act criteria, I don't know, most anybody can meet that criteria. But I think we ought to at least have a report so that we can do what we need to do to get the children the mental health treatment they need, since PIMS is apparently woefully inadequate to do that. And just hopefully by the time we do our end of July meeting, that we'll have some more information on what we can do to make sure children who meet Baker Act criteria get the help they need.
Linda?
Yeah, I've heard conflicting information, Mr. Dillinger, in the last week. At first, I heard that those beds were being temporarily transferred from PEMS, the children's beds from PEMS to Mies Dunedin. And then yesterday, I heard that it really was because the adult beds were full at PEMS, but they were going to be it was truly temporary. They're going to be bringing those kids back in a short period of time. And that ACA wasn't going to officially transfer the license of those beds to Mies Dunedin. It was just going to be temporary. So I do think we need to follow up and get the real story on that.
Well, I think we also need to know that the major hospitals will not refer children to PIMS. They send them to Bradenton or to Mies.
Okay.
Linda, you'll do some research before the 29th.
Certainly.
Additional comments? Obviously, it's important that as many of us can attend on the 29th. It's the 29th from 9 to noon. It'll be an epicenter experience, but it will be online Zoom. I think we've already gotten the details and the links from Sarah. It's just vital for as many of the board members to attend as possible, so that we can really hone in on a few areas that we can pursue and not let this wait. Everybody good with moving on to another topic? Seems so. All right. I guess, Beth, we're back to you for our CEO report update.
Well, my first topic was to emphasize the strategic planning workshop. So that has been done, and I do look forward to seeing you all there. It will be important. A couple other issues wanted to either update you or fill you in on. One issue we have been very concerned about and active where we could is eviction avoidance and our support of the Pinellas COVID Cares program. We continue to support that program in every way we know how with the strengths that we have or the resources that we have. The county has a substantial fund and it is focused in the right direction. And so our best stance was to stand back and find ways we could support it. Obviously, our FSI program does or has historically helped many of the same families, not as many and not with as robust resources. And so for those calling in 211 and identifying themselves as families, they are being first referred to the COVID Cares program. And then for items that may not be included in the COVID Cares program, diapers or food or other things that FSI takes care of, they may also receive a referral to FSI, and we would pick up those other things. But in the meantime, knowing, as we do from now, 8 years of running the FSI program, that it would be inherently difficult for individuals to pull together the documentation that they need, get that documentation into, in this case, 211, and a significant number and commitment of personnel by the county. We looked, and knowing at the same time that our FSI activity would go down as more of those families were referred to the county program, we pretty immediately moved not only a few of our staff, but who essentially navigate and assist families, as well as the family service personnel at our neighborhood family centers, and perhaps most importantly, the navigators that we pay for at HIMSS and at Gulf Coast Jewish and Family Services as part of our FSI program, to pivot all of those people who are already very capable in assisting families, understand the issues, understand the difficulty in getting documents, so that they would do the same kind of work for individuals applying for the COVID Cares program. And so at any one of our neighborhood family centers, individuals, families may make appointments there, and that's a COVID safety issue more than anything else, but an appointment there to meet with a navigator who can help them get the documents that they need, and also, of course, have the technology there of scanning and emailing those in. Some of that has been education on how to do that. Some of it has been education on how the COVID Cares program works, when to call, when not to keep calling and clogging up the 211 lines, what to expect in terms of turnaround and that sort of thing. We've done a few other things because it was clear that, at least to us, and I think to the county, that there were a lot more people who needed the help than were either getting it or even applying for it. And so one of the things we did was send out letters or send out flyers about the program to all of the FSI vendors who were landlords. So all of the landlords we have dealt with over the years received information about COVID Cares so that they might encourage their tenants to apply, which of course helps them. Some of the documentation pieces from the lease, as well as a W-9 from the landlord, actually come directly from the landlord. So it helps that much more if the landlord is immediately invested. We also pitched the story that was in two parts, really, about the program in this last week, and Lane DeGregory's story on Saturday that got personal and talked about a specific family, was a family who had been served at our High Point Neighborhood Family Center, really illustrating the severity of the issue, but also the invaluable help that that program had provided her and her family. We also participated and worked with the Resiliency Fund, of which JWB is not a member, but is working alongside, and that includes the Pinellas Community Foundation, United Way Suncoast, Foundation for Healthy St. Pete, and Allegheny Franciscan Ministries. And that group released a white page paper called Looming Storm, the State of Evictions in West Central Florida, and talked about 886 households in Tampa Bay are facing eviction, and predicts that 5,900 more families could lose their homes. Now that group is working on a regional basis. And we, of course, are Pinellas based.
Right.
So as opportunities arise to work with them and perhaps fund pieces of that work that make sense for us to do that are Pinellas focused only, we may do so. But I would have to say there are a few things we have passed on because either they are regional in their structure, which makes perfect sense for the effort. It just doesn't make sense for our funding. Or the piece that was Pinellas based was so small, it really didn't make enough sense for either the agency involved or us to go through the procurement and contract process. So we're trying to be helpful in ways that are actually helpful and not more burdensome. But we do have, as many of you do, real concern that we have a wave of impending evictions when, not if, but when that moratorium is lifted, and to keep people as current as they can possibly be is obviously the best answer. So we're using all of our resources as we can to support the county program. The other thing we are doing is if you were to go into the JWB offices, which I don't recommend, but if you were to, you would find a huge cadre of county personnel using all three of our large conference rooms, and so that they can be co-located to 211. And that has had a little bit of impact upon our very occasional use of the facilities, but not so much. It was the right decision to help the county do what they're trying to. We're all trying to help the same families, and it's not a matter of quote helping the county. It's helping the families by helping the people that the county has repurposed for this very extraordinary effort. Like everybody else, we wish more people were getting through the process faster. We know how hard it is for these families to put together the paperwork that they need to do, and we've been among many voices who've urged the county to minimize that burden to the extent that they could, given that they're dealing with government money, and that's always the rub. Relative to the JWB building itself and our use of that building, the governor's executive order as extended allows for virtual public meetings through July 31st. So things like procurements as well as board meetings, we've been able to have on a virtual basis. So in terms of this group, the next meeting that we don't know about would be the August Finance Committee meeting, which is later in the month. But what we're doing in the meantime to enhance the social distancing for any future meetings once those orders are lifted or not extended is procuring services through our current AV provider to ready our building for audio and video in both room 105, the medium-sized conference room you pass on your way to Edmonds Neary conference room, as well as 185 that's in the wing over on the left, but is also a larger conference room. so that the public could be in either of those rooms and see and hear everything real time, and then would be, could physically come to a podium within the main room as necessary, so that we could safely have board members there. And as you know and remember, often that room, the Edmonds Neary conference room, is often standing room only, which is far from safe and won't be safe for some time. So we're trying to, plan A, of course, is what we're doing here with virtual meetings, but plan B will be the having those additional rooms so that we can continue to work to keep people safe. We have mask wearing mandates for anyone in our building, whether that's our own employees who are there on an occasional basis. I think we have one individual who's working there full time, but everybody else is working for maybe 2 hours or maybe 4 hours on an occasional basis, as well as all of the county or 211 folks who are in our space. We have building cleaning protocols with SPC, who provides those services to us. And as the counties and 211 staff are going to be in that space, I believe over this coming weekend or part of the weekend, we've made arrangements for both cleaning and air conditioning for them. So we are, as you would expect, aligned with county ordinances relative to masks. We continue to work, the staff continues to work very effectively on a virtual basis from home. And so we're going to continue to do that until it appears very safe that we can be back in that building. And that concludes my report, and obviously open for any questions.
Chief Milligan.
I have a comment. And Beth, we had talked I don't know, last week or week before last about the eviction process and some concerns of what's going to happen whenever this comes to an end, and for the people who aren't doing what they need to do. But after I spoke with you, I spoke with several property managers, and they do not actually have tenants coming in and telling them that they've lost their job or they're having a hard time making rent. They're just kind of ignoring the fact and not paying the rent.
Yeah.
And that makes it difficult for those property managers to try to help them, because it seems like the people are on the run. And so automatically that puts them at their notice of, well, you're on the eviction list, and hey, when this ends, guess what? You're going to be out the door. And I feel like probably many of these people are getting that CARES money to help with the process, but they're not going and letting the property managers know. And I don't know how we get that word out to our people that, hey, listen, we know you're having a hard time. We're trying to help you, but please go talk to your lease agent, your property manager, excuse me, and let them know you're having a hard time with this, and so that those companies can work with the residents to make sure that they're not kicked out when this is over. We don't want to see all these people become homeless because they didn't do the right thing or made bad choices or what have you. Maybe they're not getting the CARES money. But either way, I'm not sure how we get the message out, but somehow we need to get the word out to the people, like, please go talk to your property managers or leasing agents, whoever, and let them know you're having a hard time.
Yeah, I agree. That's a tough one if they're not being pressed for rent because of the moratorium. They may just be laying low and not doing anything, and that's never a good idea with a creditor, no matter what. Just to be clear, if the county, if someone qualifies for the county money, and Commissioner Seal can clarify this for me, but that money is sent directly to the landlord. And so there would never be a case where the individual is receiving cash, but the landlord is not getting paid. And I don't think that was the major point you were making, but I just wanted to clarify that.
Yeah, that definitely was not a major point by any means, but thank you for clarifying that. I just would like to see the residents go and make contact with the people and let them know, hey, we're having a hard time. Even if they are still employed, maybe they're not making the money they were making before, what have you. I don't know how we help them get that word out, but I think it would certainly help a lot of people in the community when the eviction thing comes around.
I agree.
Beth, Commissioner Seal has her hand up.
Thank you. And I really do appreciate all of the help at JWB with the Pinellas Cares program. I'm sure that Beth already has a copy of what we just approved this week, but if not, I sent you a copy and maybe you can send that out to all the board members so that you can specifically see the categories. So for instance, in the individual and families program, the federal poverty level of 200% is now gone. And they've simplified the documentation requirements, expanded eligibility. We can apply retroactively for individuals. Another important category, and I talked with Doug and Cooley yesterday, is that they will be overseeing support for not-for-profit organizations for feeding programs, homelessness, behavioral health, and legal assistance for preventing evictions. And there's $30 million in that particular category. So there's public health programs, 43 million that's been allocated. So you'll have a good chance to take a look at, it's very succinct information, and I think that will be helpful. So one of my questions is, and Beth, you talked about the FSI. If they are going through Pinellas Cares and providing the documentation to the county, do we then link them to FSI for the diapers and for other needs that they might have? Can the same documentation roll over so it's used to assist them with other needs through FSI funding?
I believe so. Linda, I see Linda nodding her head. So yes, it's coming through, of course, 211, so the same number. And I don't think there's any duplication of requests for information. Linda?
No, right, and it comes directly to our navigators, and they can do this all day long. They know what the criteria is, and if they've met the COVID Cares criteria, they are eligible for assistance through FSI.
Okay, great, thank you.
So that's all I had, unless there were other questions. But I commend the commission for those changes. Being close to the trenches, those are the kinds of things that we were hearing that would be most helpful. Yeah, Linda?
If I could also add, April Pucciolo from JWB, our communications team, is part of a work group that's developing a strategy with the Community Foundation and the county to come up with messaging. And one of the things we just talked about, April and I, last night, is getting the message to the tenants that their rent isn't forgiven. It has to be paid. They have to understand that you can't, it's not, they didn't moratorium your payment, they just delayed it. So that was the messaging that we talked about needed to get out. So April is directly working with that group.
So to Chief Milliken's point.
Right.
Yeah.
All right, I'm looking at other hands for questions for Beth. Questions, comments, concerns? Then I'll go ahead on the agenda. Does anyone need to or request to pull any of the information items off of the agenda?
But I wanted to add a comment to the rent thing. The provider in Hernando and Pasco and Citrus is with Electric. So they started terminating or cutting off people's power who were behind since March. And so I asked what percentage of those people whose power was cut off for non-payment actually came up with payment, and it was about 75%. So I'd be curious to see what happens with the rent situation. And cutting people's power when you're under a heat warning seemed pretty extreme, but people came up with the money.
Okay. Then at this point, Laura Peel, do we have any requests for public comment on the open agenda portion of our meeting.
I'm gonna give it just a moment to make sure there aren't any. But at this time, there are no public comments.
Okay, then before we adjourn, two last orders of business, let's go ahead and recognize our staff celebrating anniversaries in the absence of Mr. Butler. For the month of July, Danielle Hintz, 18 years. Shannon Phillips, 15 years. Joanna Maniscalco, 13 years. April, I can't believe April Pucciolo, you're here 7 years already. I remember when you came. Erin Craig, 1 year. And Jennifer Manick, 1 year. So congratulations to our staff. And I do know from chatting with Beth pretty frequently, you're having town hall meetings and gathering your staff and celebrating successes and accomplishments and just staying in connection with the staff. So I appreciate that. One more note of business. During the course of today's meeting, it was mentioned that a finance committee meeting is taking place on Tuesday, August 18th at 1:30. And typically just the finance members attend, but it is a meeting that's open to all of our board members. So that's Tuesday, August 18th at 1:30. And Sarah can always send out the link to the Zoom meeting if you'd like to attend. There is no official board meeting in August, as is typical. The dates in September have changed because of the trim meeting and the trim meetings. The next official board meeting is Tuesday, September 15th at 3:30 in the afternoon. So we'll be sure to get that information out there, but just a reminder about a few things coming up that change a little bit from our routine. And barring no other comments, I see no hands. I will call to adjourn this meeting of Juvenile Welfare Board. Oh,
So
yes,
moved.
sir.
We're
So
good.
moved. Do we have a second to adjourn this meeting?
Second.
All right. I think we're ready to go, right, Colleen? No vote needed. All right. Have a good day, everybody.
Thanks, guys.